Hey, good morning to everybody. Happy Saturday. It's Daryl here. It's 5 a.m. here in Connecticut on the East Coast. I want to talk about Trump, his packed rallies, his proposed Wisconsin rally. Something I've heard about recently, I don't even know if I should mention it, a declaration. I'll leave a link below. I don't want to even mention the name of it. And herd immunity. All right, we see a spike. We see another spike. Just yesterday it was 70,000, over 70,000 new cases. Now, as these new cases come, eventually we're heading back up to 1,000 deaths a day. As the deaths go up, the hospital beds, they increase, the hospitalizations increase. The available beds, the available room for different patients. Take, for instance, last March I was scheduled to go in for a hip replacement. I had severe arthritis. I had no cartilage left in my hip. I could not walk. I was in excruciating pain constantly. That I couldn't go in for an operation. I had to wait 3 months, not being able to walk. Me and thousands, tens of thousands of people across this whole country couldn't go in for operations of all different kinds. Dental work. So you see, when these cases go up, it's not just a few people with health problems that get sicker and die and pass away. You know, it's not like the flu as people are trying to push it. This is a pandemic. It is of much more consequence than just the flu. Now, I see this other disturbing trend with Trump. I remember him canceling a rally up here in New England. It was in New Hampshire, I think, because of coronavirus. I remember him, hardly holding any rallies. Him and Biden pretty much having no rallies. But all of a sudden now, you see these rallies day after day, or 2 rallies a day, with 10,000, 15,000 people packed into these rallies. Even as, like with Florida, I believe yesterday they had over 3, 4, maybe it was even 5,000 new cases. If you look on world meters, you'll see the exact number. Florida, I think, had the highest incidence of new cases yesterday. And Trump is holding these rallies regardless, packing people in there. No masks, no social distancing. At the same time, the White House and his science advisor, Dr. Scott Alice, who has no experience whatsoever in viruses or anything to do with this. That's his science advisor on this. And they're pushing this herd immunity thing. So you start putting these two things together. Trump has no problem holding these rallies. Geez, and it's a coincidence now, because now he considers himself immune to this virus. He's immune. His wife, his son. We know that after the body builds up antibodies, and there's a good chance he and his son and his wife probably are immune possibly for a short while. We're not sure. But the rest of that 10, 15,000 people, they sure aren't. They could easily end up in the hospital or dead. And if they go in the hospital, any medical attention they get as a result of this rally takes away medical attention for the rest of the country, the rest of the people. As more people get sick, more resources are going to be drawn to these people. So it's not just a matter of your freedom. Well, hey, I don't want to wear a mask. I'm not going to wear a mask. If I get sick, I get sick. No, because it's going to affect the rest of the country. It affected people like me. Like I said, I had to go 3 months without this operation because of the coronavirus, because of hospital resources. And now I'm starting to see, like I say, it seems like Trump isn't concerned at all about this. It seems like they're pushing this herd immunity. And coincidentally, Trump and his family has nothing to worry about because they're immune. So and even if they did get sick or do get sick, they've got a team of 10, 12, 15 doctors and all the best drugs. So it's of no consequence to them. To the rest of the country, it is. And then I came across this declaration. I hadn't even heard of it till this morning. And this is a push for, I forgot what they called it. Some kind of protection. They're trying to push herd immunity. This declaration has 9,000 signatures. It's a nationwide push. Well, not nationwide. It's a Trump supporter push for this herd immunity thing. But like I said, there's 10%, not even 10% of the country so far has been infected. We have to hit 60%. What would that mean for the next year of all the hospital resources, all the deaths across the country? I can't even, I'm not that good at math, but I can't even, it'd have to be in the millions of people dying. And then I can't imagine what that would do to hospital resources. There would be no room in the hospitals for anything else other than the sickest patients. If we're going to go from maybe 8% of the country being infected to 60% to hit herd immunity, that means these hospitals are going to be packed with nothing but coronavirus patients, the severest patients. And that's not just going to affect them. It's going to affect everybody else. Somebody that wants a hernia operation. Somebody gets hurt on the job. Somebody with back problems. It's going to affect the entire country. I think these people paint it as it's nothing worse than the flu. We'll all get it. We'll get over it and we'll move on. I don't see it being that simple at all. I think it's a false solution. Once again, Trump is trying to take the easy way out, and in a way that doesn't affect him whatsoever. It leaves him and his family totally unscathed, but it leaves the rest of the country suffering. Yeah, that's not what a president is supposed to do, if you ask me. All right, I'll be back later with another video. I'm debating about leaving the name of this declaration down below because I don't want to give them any more exposure than they've already gotten. Again, it's about herd immunity. All right, you guys have a good Saturday.